Hi, good morning, everyone. So this is our Unit 5 discussion. Today is April 4th, Tuesday. So we are over halfway done. So keep up the good work. We're on the downhill slide, right? So here are our objectives for Unit 5. We're going to be talking about a little bit more specifically about your role as a surgical technologist, what you can and can't do, and like the history of where the role of a surg tech came from, because it's actually a relatively new profession in the scope of history. Again, these are our other objectives that we pretty much relate to every week. So the assignments due for this week are posted here. Notice there's another bigger assignment here worth 90 points, so make sure you get that in. You don't want to miss out on those points. That will definitely affect your grade. Again, your discussion post, like every week, is due Wednesday, your first post, and then you need to respond by Sunday to 2 other peers for full credit. So again, I'm still seeing a lot of students not respond to peers. I'm having to take off points for that, and I don't want to do that. And make sure you're posting all of your sources in APA format. Okay, those are typically where I'm seeing points taken off, but in general, your discussions are good. Your analysis of the topics, the questions posed are really good. So keep up the good work there. Okay, so the surge tech, how do I know what I'm allowed to do? What do I know, my role in the operating room? What can I do? What can't I do? So first of all, we've kind of talked about this a little bit in the past, but surge techs are governed by federal, state, and administrative law. So it is your job as a surge tech to know what those laws are. Okay. Never ever rely on hearsay. Okay. So what I mean by that is, you're working with your friend in the OR and they're like, yeah, it's okay if you use the Bobby on this patient or whatever it is. Okay. You can't go by what they say because when it comes down to it, and you're the one that got in trouble for doing whatever it is you did, it'll be your name, your career on the line, not that friend that told you. So be very careful of that. They may think that they're right. They may have, even your best interest in mind, but when it comes down to it, it's your job, it's your responsibility to know what you can and can't do. So whenever you get hired at a new facility, you're going to be given either paper or probably digital now, a big packet of specific hospital policies that you can and can't do. It'll specifically state, yes, this is within your scope of practice. You'll see that term a lot, scope of practice. So make sure you're aware of those because it does dictate what you can and can't do on it on any given day. So now we're going to talk a little bit more about these others. Federal laws are across the board, basically, any state, it doesn't matter. So there are certain things that um, are going to be a law no matter where you go, no matter where you work, is assuming you stay in the United States. International law is going to be different. The HIPAA laws are the same no matter where you go. That is your patient's, the Healthcare Insurance and Portability Act respects patients' privacy. We've talked a little bit about that in the past about, what you can and can't um, talk about with the patient or talk about the patient to somebody else, what you can't post on social media, protecting that patient's identity and rights. Okay. OSHA is like your occupational safety. There are certain things that you can't do as an occupational safety hazard that would be the same across the board. FDA is your Food and Drug Administration. They set a lot of regulations on things that the Joint Commission will also take into consideration that you can and can't do. So state laws are going to maybe vary slightly by state. So it may not necessarily be specifically stated in one of these federal laws. Okay, like the surge tech cannot do such and such. Okay, but your state law may say that, in the state of Ohio, you are allowed to irrigate. Okay, but maybe in West Virginia you can't. So I live right on the border of Ohio and West Virginia. So, I also work another job where I have clinical sites in both states. So we have to kind of be aware of, what the student can do, maybe what, this particular facility allows. So you may be in a position like that at some point. So be aware of the different state laws, and we're going to show you how we can look those up here in a minute. So state laws will set something called a State Practice Act. That is something that defines our scope of practice. So that term, scope of practice, is referring to, everything that you as a surge tech are allowed to do. Is it within your scope of practice? Can you do that? If it's out of your scope of practice, that particular function would fall on somebody else. That's somebody else's job. Maybe it's the circulator or the first assistant. It could be somebody within somebody else's certification, licensure, whatever. So we you'll hear that term a lot, scope of practice. So they are set forth to protect and benefit the public. That's really why we do that. Yes, it does govern what we can do, but it governs what we can do because we want our patients to stay safe. So remember, agro primo, the patient first. It's always about the patient. So don't get your feathers ruffled if somebody tells you, no, you can't do that, right? It's not personal. It is just within the patient's best interest. You may think, well, I know how to do that. I've seen it done a million times. Sure, I can put this lidocaine jelly in the urethra. That's a concern. But if any one of those laws says you're not allowed to do that, that's it, period. There's no really getting around it. Because if you do and you get caught or there's an injury to the patient, you are liable. So that means you could go to court and face charges if something did happen and you were functioning outside of your scope of practice. So it is very serious. You can be held accountable for those actions. The state laws, like I said before, do vary from state to state. So if you are a traveling surge tech, once you graduate, get certified, and you start to travel, you need to definitely be very aware of what each state will allow you to do, because you can't use the excuse, well, I was just practicing in California, but now I'm in Iowa. It doesn't matter. You have to know what you can do. So if you're ever curious or you want to know, you can search for go to Google or whatever, search state legislature, Ohio surgical technologist, or fill in your state, whatever it is. And then you can actually look up legislature by number, the legislature that's been passed, and anything pertaining to surge techs will come up. So a lot of laws anymore that have been passed will actually have our title in it. It didn't used to be like that in the past, but now our career has become very specialized and it's its own thing. So laws have since been passed because of that. So I want to pull up a couple websites to show you what I'm talking about. If you want to go to AST, here's this link, but I'm going to pull it up for you anyway. But you can go to AST's website and it will show you, you can click on the state map down here, and it'll show you what your state laws are, what you can and can't do. So that's a quicker, easy way to do it. I like to show this to my students. So if you're not familiar with AST, just briefly, AST stands for Association of Surgical Technologists. They are a group that if you want to maintain your certification, you have to be a member of. We're also going to talk about your certification test here in a little bit, but you can also become a student member. You don't have to wait till after you graduate. There are some student benefits that you can take advantage of. So we're going to navigate this site here in a minute. Let me pull up a new screen. Got a lot of tabs here. All right. So here's the AST website. I am a member, so it should let me go anywhere. I think I've logged in. But you can see here that they're going to advertise their upcoming conferences. They do a national conference every year. They have special things for students. The Scrub Bowl it's kind of a newer thing that they started. Chicago is the next national Surge Tech conference. It's usually at the end of May. So this year it's May 25th through the 27th. I'm not sure if I'm going to go yet. It's It's right around my kids' birthdays, both of them, so it always falls right then. But it is a good way to meet other surge techs, to, bounce ideas off each other. For support, you're going to hear a lot of good speakers. You'll get continuing education units if you are certified. So, I mean, it is beneficial for sure. So to go back to that map, here, there's a lot of links here you could click on. If you go to legislation and click on that map of state laws, log me back out. Let's log back in. All right, so here's where it was. For example, I'm going to click here because that's where I live. I live in West Virginia. You scroll down and it will tell you basically what you can and can't do. And all of them are going to say, generally speaking, surge techs work under the authority of the physician. We always work under the surgeon in the room, okay? It's just like chain of command. It does say that physicians or surgeons may delegate to a non-physician, that would be us, those tasks normally carried out by another who perform under the direct supervision and in the physical presence of the physician, who has been determined that the person who those tasks are to be delegated has the appropriate skills and knowledge. So that is saying I think the name of that law is like doctrine of the borrowed servant or something like that, where it's saying the surgeon is like the captain of the ship and is allowed to delegate certain tasks to non-physicians if they're performing it under the supervision of the surgeon, and they have been deemed knowledgeable to do that. Okay, so that is kind of a caveat, so to speak, that would allow you to do certain things in your facility. It says surgeons or surge techs here not only serve as the surgeon's co-pilot, basically you're their right-hand person, provide instrument supplies to the surgeon. They also prepare the operating room. So we're going to talk about all of the roles here of the surge tech here in a little bit more detail. I did want to point this out to you though. I read this. I thought it was interesting. Surge techs may also play a critical role in preventing surgical fires. For example, a recent study demonstrated that 78% of surgical fires were due to electrocautery. I wanted to point that out because we had just finished talking about OR fires, risks of fire in the operating room. So they make it a point to point that out to you, that it is important for surge techs to mitigate that risk. Okay, let's go up and click on another one. Some states have a little bit more laws than others. If they're a little more progressive, it's going to take a long time for anything to change in West Virginia. Okay, California is a little different. So you can see they actually list specific law like numbers because things have been passed there. So it talks a little bit more about scope of practice. Here it even specifically says the surgical service operating room shall have at least one registered nurse assigned to the duties of circulating nurse and a minimum of one additional person serving as a scrub assistant for each patient occupied room. So it's saying you have to have adequate staffing per room and who those people can be. Let's see here. You can even print this off to your employer if there's ever questions. So that's kind of interesting. Kind of goes into the same thing that I had mentioned before. So you'll see a lot of those throughout each state because it's going to be pretty similar. Let's find another one. Over to New York. See what's happening there. Yeah, there's a whole law here. Let's actually open it. So you can pull these out. You can even print these if you needed to. Specific laws regarding to surge tech. It will even list the job duties, what a surge tech is. It defines specific things like healthcare professional, if there's ever a question about that, all the legal jargon. A surgical technologist shall not perform surgical technology except under the direct and supervision of an appropriate licensed healthcare professional. So you can't be a surg tech without a surgeon in the room, I think is essentially what it's saying. Some states you will see have a minimum standard for certification, that you have to be some sort of certified surg tech or have a certification. We'll talk about the certification here in a few. So I just wanted to show these to you. Move my bar here, you can see. I'm going to close out of that one. We're going to go back to this PowerPoint. Well, lost my mouse. Sorry about that. So let's go to the next slide here. All right, hopefully this works now. So we looked at our state laws. Okay, this was the map. Now I said we'd talk a little bit more about, the roles of each person in the operating room. The who's who, kind of threw some pictures here to help you. You're probably familiar with most of these by now, but let's go ahead and talk about them. So you obviously have the surgeon. Like the state of New York said, you can't function as a surg tech without a surgeon, right? There'd be no job for us. So the surgeon is the sterile team member that is doing the operation. A lot of different types of surgeons, right? You've got surgeons who specialize in, let's say, neurosurgery, pediatrics, orthopedics, whatever it is. You have surgeons who are MDs that just do general surgery. So they're also going to be governed by their own laws and rules of what they can and cannot do within the operating room. So, they may not be qualified to do brain surgery if they're a general surgeon, right? So they do also have boundaries. Anesthesiologist or CRNA is going to be the person who is in charge of the patient airway, putting the patient to sleep, all of the drugs needed to get that patient safely through surgery. So a lot of facilities will, at least in my area, I guess I can't speak for everybody, but in our area, we have one anesthesiologist assigned to maybe one or two, three different rooms. And the CRNA is the person who will intubate the patient and stay with the patient throughout the entire procedure. And then the anesthesiologist will float between those rooms. Some facilities may not do it that way. So a CRNA stands for Certified Registered Nurse Anesthetist. So they are a nurse, but they've gone through specialized training. They have had several years of critical care skills before they went back to school for their CRNA. Now, the circulating nurse is typically going to be a registered nurse that works in the OR. They typically function as the non-sterile team member. So they are also going to interview the patient, make sure that, the medical history, all the forms are there. The surgeon has signed off on this case. They're going to bring that patient to the room. They're going to be in charge of positioning the patient, making sure that the patient is prepped properly. They're going to do the surgical prep, maybe even put in a Foley catheter if need be. They're going to be the ones that pull the medicine from a specific med cabinet or med pyxis. We are not allowed to do that. That's one of those things that's not in our scope of practice. We're not capable of pulling drugs that's going to be needed for on the table. So the circulating nurse has to do that. They'll also chart throughout the case. Anything that happens, they're gonna, keep that medical record. Anything that we need while we're scrubbed in, the circulating nurse is gonna go get that for us because we can't break scrub and go touch something that's not sterile. So they are in the room as the non-sterile individual. They do a lot of running, so be nice to your circulating nurse. They a lot of people give them a hard time that maybe they sit through the whole case or something. They have their own job that they have to focus on, and they do a lot of running and work too. So be nice to your circulating nurse, okay? Then you have the first assistant. That's going to be the person right up there with the surgeon that is going to be their literal extra set of hands. So some facilities will allow surge techs to function as the first assistant. Some states don't necessarily pay you more for it, some do. Some will recognize a certified first assistant. You can get your CSFA. The state of West Virginia and Ohio do not recognize that, but some states do, and you'll get paid more. So it's kind of an incentive. I like first assisting, so I got to do it a lot, even though I didn't get paid more for it. I like to be up there and, you've got your hands in there. You can really see what's happening. You're up close. You're retracting, cutting suture. So you still can't like alter tissue, but you can be that extra set of hands. So it could be the surge tech functioning as a first assistant. It could be a certified first assistant, or it could be even another surgeon or a physician's assistant. Maybe the surgeon has their own person that they bring to the OR with them from their office called a first assistant. So it could be a lot of people. It could be a resident or a med student. So that gives you a little bit of an idea of who you're going to see in the operating room. Now, you may see some other people come and go that may not necessarily be one of these core individuals. You may have, for example, we do C-sections, cesarean sections for baby deliveries in our OR instead of a separate place. So a nursery nurse will have to come down to help with the baby. So you'll see people like that come and go. Radiology, x-ray techs also come and go. Reps for different companies, like especially orthopedics and neuro, they're going to have a rep from the company come in for their trays. Okay, so where did the surge tech come from? So like I said before, it's kind of a relatively new profession in the scope of the grand scheme of history. So nurses have been around a long time. Doctors have been around a long time. But the actual role of a surge tech has just kind of developed a little bit more recently within the last 50 years. Before that, our job just fell on a nurse, really. So the actual surgical nurse didn't start until the 1800s and went on to the 1900s. Before that, most of it was just doctors helping each other out. And there really wasn't as much surgery going on as there was, in more recent times because of the development of, you know, different techniques, aseptic technique, but antibiotics. Those things kind of helped promote surgery. So then we're into World War II. That's really what spawned the need for more surge techs because there were a lot of casualties. There were a lot of things that, needed operated on, like, things on the battlefield. So there was an increased need for surgical assistance. Again, the development of antibiotics led to more surgeries. The more surgeries, the more people, needed to help out with those things. So initially, aside from surgical nurses, they started to develop Army corpsmen to function as operating room techs, ORTs. That was the very first specialized type of surge tech, you could say. So the military was huge in the development of our job, and because of the battlefield injuries. So military did play a very crucial part in the development of surge techs. So then in 1965, they started letting civilians train as operating room techs. So between World War II and 1965, it was typically just military trained only. And even to this day, they still have military trained surge techs. That's actually kind of what got me interested in this job. I was kind of at a loss. I didn't know what I wanted to do with my life. So I was considering going into the Navy because I saw a job on Indeed that said Navy Medical Corpsman. And I was like, well, that sounds interesting. So I looked into it, and that's how I learned about surgical technology, was through that job posting, because I thought that sounded really cool. I didn't end up going into the Navy for other reasons. I ended up getting married, but that's how I found out about it. So I decided to go to a local school instead. So that's where your operating room tech started, all the way back in 65. It kind of quickly grew into something they knew they needed a little bit more specialized training for. So things are developing at a rapid pace in this time frame. the development of surgical techniques is expanding, etc. So in 1967, AORN, which is a separate group, typically more for nurses, we do kind of fall under them in a way, stands for the Association of Operating Room Nurses, developed a training manual specific for ORTs. That's how they started developing these civilian programs. Then in 1970, so you can see only 3 years, they're developing even further. 1970 was the first certifying exam for surg techs, ORTs, and it was put forth by the LCC-ST. So that is what turned into the AST. So in 73, the AST was formed and became what we know it as today. So the AST replaced the LCC. So now we are, once we take the exam put forth by the NBSTSA, we are CSTs, Certified Surgical Technologists. All right, so let's talk a little bit more about the specific job functions of the Certified Surg Tech. So you saw some of those listed, and I'm going to pull that back up here in a few, of what you can and can't do, right? What specifically is your role even in the OR, right? So we can divide these into a couple of things. We can say our role has a sterile function, a non-sterile function, and then this miscellaneous category just kind of like falls into a lot of different time frames. So the sterile role, we're responsible for gowning and gloving ourselves. That's something you're going to learn in the skills lab, how to do it sterilely. And gowning and gloving other sterile team members like your surgeon, your first assistant. A lot of times we take that upon ourselves to gown and glove them. A lot of surgeons actually don't even know how to gown and glove themselves. It's kind of funny. We are responsible for maintaining the sterile field. That kind of goes hand in hand here with this last one, applying aseptic technique. We've talked about that term before. So that means making sure that you're using your surgical conscience to make sure everything that we do is done sterilely. Every function, every move we make has to be done in a manner that prevents infection or is done sterilely. We can draw up meds. Now, remember, I said the circulating nurse is the one that pulls those meds from that Pyxis, but they're going to deliver that to us on the sterile field. So you're going to be responsible for accepting those meds, labeling them properly, and then drawing them up and passing them to the surgeon. Every time you pass that to the surgeon, you always state what it is so they know. So just because you don't pull the meds or inject the meds, it's still passing through your hands. So you have to know what it is you're doing. You'll take a pharm class because you're basically the last step here with these medications before it gets to the patient. I've even seen some surg techs not even state what the drug is when they pass it to the surgeon, which is not good practice. I would not recommend that. The surgeon has a right to know what is being passed to them before they give it to the patient. So you need to understand what it is you're passing, because if something's not right, you have the responsibility to speak up, right? So you are that patient advocate. So that's a big one. Passing instruments is probably the main thing that most people know that we do. You pass the instruments and that's it, right? That's what I hear a lot of people say. They don't understand, what actually goes into the day of a surg tech. There's a lot of things that have to happen besides passing instruments. Yes, it's a big part of it, and knowing the procedure, the surgeon likes and dislikes, the anatomy, all of those things have to happen instantly in your brain in order to pass the right instruments. So there's a lot that goes into it, a lot of critical thinking skills. We're responsible for preparing suture. No, we do not suture. Some facilities will let you become like a specialized training to suture, or if you get your certified first assistant, they may let you, but as a surgical technologist, we cannot suture. It's basically considered altering tissue. Now, in our area, some will let us staple skin. They'll take that skin stapler with the surgeon under the direction of the surgeon and staple skin, but that is going to be probably one of those things that might vary by state. So check your state laws. We're responsible for counting. You've heard the horror stories of, the sponge got left in a patient for 10 years and, it came back and they had a huge issue or whatever. That was a surge tech's job and they failed. Okay, so be sure that you are counting initially, in the middle of a case, anytime you close a body cavity within a cavity, and at the end of the case, all of those counts have to line up. Now, if you miss one and you recount and you're still missing, there are steps that you have to take in order to rectify the situation. Either the surgeon has to stop and help you look for it, we look until we find it, or we get an x-ray to see if it's in the body cavity. A lot of times if it's little like a needle, sometimes they fall on the floor and they're hard to find, but that's your job. It's your responsibility for keeping track of all of those things that are countable. Some facilities will let you assist the surgeon. Like I told you before, you could function as a first assistant, and you're going to apply aseptic technique to all of these things that you do. Now, the non-sterile role, you are not going to have the gown and gloves on, the sterile gown and glove. You would not have done a surgical scrub for these particular things. So you may need to pull items for the case. Depending on your facility, that may fall upon somebody else. It could fall upon you. So when you get hired, you'll learn whose job that is. So this is a case card up here. You may be responsible for like finding this, we call it a preference card or a preference pick sheet, whatever, and taking that for that particular surgeon with that particular case and finding everything that that surgeon wants and needs and putting it in a case card for that case. So you may do that the day before or in the morning, in between. So it could happen at any time. You need to make sure that everything that you need for that case is in your operating room. If you know that this surgeon needs this particular OR bed for this total hip, okay, before you set up that case, you need to make sure that that's in the room. Okay, you can't rely on somebody else to do it for you. It's still your job. The nurse will help you, but that's really one of our big things. Bed positioning, this can kind of go both ways. Sometimes we can get the bed ready, like I said, like for that hip case or whatever. But once you start scrubbing in, the position of the bed kind of falls back to the circulator. Some facilities even require you to reprocess or sterilize instruments. Not all facilities do. That might be a separate role, like the central sterile supply person, the sterile processing tech might be responsible for that, but smaller facilities especially, they have to reprocess and re-sterilize everything, maybe at the end of the day, in between cases, whatever it is. So you'll have to learn all that, even if you don't plan on functioning as a sterile processing tech. You might still have to do that as a surge tech. And then miscellaneous here, you're always going to need to communicate no matter where you are. Proper communication is important for patient care. Providing psychosocial support to the patient. So our interaction with the patient is pretty limited usually because most of our patients come in and within a few minutes they're put to sleep. But within that few minute time frame, you do have the ability to make an impact on that patient. If you are, even if you're scrubbing and you're setting up your back table, you're messing with instruments, and that patient comes in, you still have a few seconds that you can stop what you're doing, have a small conversation with that patient if they're awake, and kind of put them at ease. They need to know who's in their room, make them feel like, they're welcome here, that we're going to take the best care possible of them, and that we're not just like rushing around them. They get, it's a lot of anxiety coming into an operating room and having people just buzz around you without acknowledging who you are. So take that into consideration. You are going to participate in continuing education. So as you become certified, you pass that national certification exam. To maintain your certification, you have to have continuing education credits, and we'll talk about those requirements here in a bit, but it's important to maintain your education because the field of surgery always changes. There's always a new technique or a new product that we have to keep up with. It may be within your job description to precept. So the term precept means to take someone under your wing and teach them your job. You as a student are going to be with a preceptor, somebody who's been working in the field and knows what they're doing. Someday that might be you, but when you become a preceptor, you need to remember what it was like to be a student. So it may take a few years for you to be comfortable to be a preceptor, but it's a very important job. It's a very important aspect of our job as a surge tech. We want to make sure that the next generation of surge techs are good, well-trained, empathetic. There's a lot of, important characteristics that a surge tech needs. And if you view this as a hassle or, something you don't want to do, you don't want to teach anybody, then, maybe this isn't for you, right? We got to make sure that you would treat a student like you wanted to be treated as a student, right? And then emergency response can fall anywhere, whether you're scrubbed in or not. You will need to know how to do CPR, basic first aid, basic life support, BLS. Know what you can and can't do in those emergency situations like cardiac arrest or the OR fires we talked about, responding to a malignant hyperthermia case. So we'll learn more about those particular instances later. So let's look at this website here. This is a little bit more of a description of the role of a surge tech. Okay, so let me scroll back up here. This again was on the AST website, and it tells you what the AST views as the role of the surge tech. So it says, surge techs are an allied health professional. That's our kind of our umbrella under allied health. Integral part of the team, providing surgical care to the patients. Again, works under the authority of the surgeon to conduct invasive and non-invasive procedures. They're experts. So the role of the surge tech has really developed into a very specific niche that can no longer be under the umbrella of just a nurse, right? There's far more things that we have to learn now as a surge tech than 50 years ago. So it's very specialized. They're experts in theory and application of principles of asepsis and sterile techniques. It's huge, right? And we're going to do that by incorporating our knowledge of human anatomy, surgical procedures, instruments, again, the diagnostic procedures we just learned about. All of those things will come into play. Education, so this is telling you if you want to sit for your NBSTSA exam, the certification exam, you have to graduate from an accredited program that is accredited by CAHEP, and the ARC STSA makes sure those guidelines are in place. So the credentials, once you sit for your NBSTSA exam, this right here, you pass, you will pass, right? You become a CST, a certified surgical technologist. Okay. And then it says you have to maintain your membership of AST to continue your education. Units, they keep track of your CEUs and submit them to NBSTSA. See here, what else do we have? So the professional organization, this is just saying that AST is really the only professional organization that surge techs have. Nurses have a lot. Nursing have a lot of professional organizations they can choose to be a member of. We don't have that option. We really don't have a choice. We have to be members of AST. Let's see here. Here it is, role of surge tech. A lot of these I had already mentioned, but here they are, maybe a little bit more specific, like securing tubes, cords, sterile accessories, participating in the patient timeout, raping, making sure you have all the solutions, etc., checking equipment. It even breaks it down into intraoperative duties, so things that happen during the case, right? Anticipating the needs of the surgeon, huge, but it comes with time. You can hold retractors, you can sponge, cut suture material, work on robotic things that might require special training, depending on your facility. You can assist with prepping. Now, typically you're scrubbed in most cases, so you won't get that opportunity. That would be your circulating nurse, but it can happen, preparing dressings. So if you're ever curious, you can come back and look at these. A lot of additional duties, some that you may not have considered. Assistant maintaining normothermia. What does that mean? So thermia is like your heat, maintaining patient body temperature. You can give them warm blankets. You can make sure the OR temperature is in an adequate range for that particular patient. You can adjust it accordingly. Okay. Caring for specimens. So yeah, just look through some of these. Right? PowerPoint. Next one. Okay. So how do I become certified? If you go to the NBSTSA website, which is www.nbstsa.org, this is the certifying body. This is the company in which you will take your certification test through, your national certification test. They certify CSTs and certified first assistants, CSFAs. So I know this is kind of a wee bit of a pain to jump back and forth, but I'm going to do it anyway. Here's that homepage to NBSTSA. So let's navigate this for a few. Click on CSTs. First time applicants. So it tells you how you can set up your exam. Sometimes the program you're in will set it up for you and actually make it a requirement, which is a good idea in my opinion. Exam prep, let's look at this. So if you're ever curious, when you get close to taking your exam, I'd say within at least 3 months, you want to come and start really cracking down and preparing. You can look and see what types of things are going to be on the exam. So exam content outline. There, you can even get practice questions. So here are the types of things in which you'll find the 175 questions. 150 of those questions are scored. So they use 25 as kind of like they're using those questions to see if they perform well on the exam. That's kind of something they do on their end, and then they don't actually count against you. But you don't know what those 25 are. So these are the types of content you're going to see. Questions about gowning and gloving. You've got preparing the surgical site, timeout, all of these basic surge tech things that you are going to learn in the next however many months, right? Intraoperative things. So it's not just, it's not just passing instruments. There's a lot of very specific things that they're going to ask you. And honestly, it's probably going to be one of the hardest tests you'll ever take. Okay. I'll just be frank with you. A lot of students have come out and said, man, that was the hardest thing I've ever done. I don't think I passed. But usually they do. Okay. It's just gonna wear on your brain because they want to make sure that you are a competent and qualified individual, right? So we can turn you loose in the OR. Anatomy micro. So they break it down by topic. Couple practice questions there. So that just gives you an idea. So the NBSTSA is the one who is going to certify you. And then AST is going to be the one who maintains your certification after that. Now, if you let it lapse, you let your certification lapse, you can either retest or you really just want to pay for those CEUs before you do that. Okay. Most facilities will require your certification. Some don't, but they're leaning more and more towards requiring certification for surge techs. All right, so hopefully that was helpful to you to kind of get the big picture of what you're going to be doing as a surge tech, who you are. Your job is super important. They always say behind every good surgeon is a good surge tech, and that's so true. A lot of surgeons can't do what they do without without us. And you know, it's a shame that more people don't recognize that, but you do play an integral part in the surgery in the operating room. So if you have any questions, again, please feel free to reach out. You're welcome to get with me. We'll try to set something up if you want a Zoom meeting, or just email me here. I do have office hours today from 12 to 2 where I'm a little more available, but we can make something work if that doesn't work for you. All right. Hope you guys have a great week.